It's 8:15. Good morning, everybody. Welcome to our San Jose Downtown Association June meeting. I am Katia McLean, Managing Principal of Steinberg Hart and President of the Board of the San Jose Downtown Association. The Zoom event is being recorded and will also be on Facebook Live. Please use the chat to ask any questions during the presentations, and we will forward those to Supervisor Chavez and Councilmember Peralez's office. Welcome again. To start this meeting, we have been talking about the reopening, and with June 15 coming up just right around the corner, I asked the staff to give us a brief overview of what we can be seeing in the next couple of months. So I'm going to pass it to Scott. Scott, good morning.
Good morning. I'm Scott Neese. I'm Executive Director, San Jose Downtown Association. For those of you I haven't met yet, we are looking forward to doing our next public meeting, kind of hybrid, in person and virtual as well, but wanted to kind of bring you up to speed with what we're looking about in the next few months. So Tuesday, we're going to turn a major corner on the pandemic. We'll be able to step inside businesses that have been closed for 15 months. And it feels like some of the limbo and uncertainty that we've lived with since March 2020 will lift. The Downtown Association is laser focused on the reopening of downtown. 10 months ago, we created a short-term, 2-year strategic plan to get us on the other side of the pandemic and what recovery looks like. This plan, which is on our website, is guiding the board and staff as our organization, like the business and property owners we represent, has had to find new paths forward in these extraordinary times. One goal of the stabilization plan is creating a more equitable downtown with access for all. That includes how we communicate through language, imagery, and data. One of the first things we had to do in March 2020 was helping sort the barrage of information so our members could focus on survival by introducing our weekly Thursday message. 68 weeks later, we are still doing it. On the right is the message that went out yesterday. So we're still deciphering all of the latest info, including how we're going to wear our masks next week. As more businesses reopen, more help is needed. Each week we do a roundup of downtown businesses that are hiring. We share this info on our website, media, and downtown online, kind of a good old-fashioned job board. As people are returning to downtown, one change you're going to notice is in the parking. Validation program is gone, and in its place is 90 minutes of free parking in 5 Park SJ garages. Go to parksj.org to make sure you park there. Nowhere was the resilience of our small business community better exemplified than in the businesses that shifted their operations, adapted to takeout, al fresco, the mask rules, and reopened new storefronts despite the pandemic. And more businesses have soft opened or are getting ready to turn the lights on, including new entertainment venues like Rec Room, Guild House, San Jose Social. Offices are starting to open back up too, with employees returning to new hybrid schedules, part in the office, part work from home. Museums and theaters are back in business, along with galleries and other downtown art venues, including the return of performances, plays, musicals, dance, filling again our beloved downtown venues. So what can we expect to see downtown through the summer months as we reopen? We successfully moved the Downtown Friday Farmers Market to SOFA last month. If you haven't checked it out yet, it opens at 10 a.m. this morning and runs through 2 p.m. Even Austin Powers is a regular shopper at the Farmers Market now. It's fitting the first big community event will be Juneteenth next week. And it's also fitting we come back in June, which is Pride Month. This, by the way, is the new mural on Lightston Alley. Our restaurants are the backbone of our small business ecosystem. Dine Downtown starts in a couple weeks. So any restaurants, if you haven't signed up yet, there is still time. For Downtown Doors, we have already received more than 120 submissions from student artists. The Downtown Foundation is judging later this month, notifying winners at the end of June, and planning a big reception in the fall to celebrate all the winning students. The city is kicking off Viva Parks with activations in Plaza Park and St. James Park throughout the summer. And speaking of St. James Park, the Downtown Association is bringing back Starlight Cinemas, outdoor movies in July and August. Over at San Jose State University's South Campus, the Women's Tennis Association is bringing the Silicon Valley Classic back August 2nd through 8th. South First Friday street markets will return to SOFA First Fridays in August, September, and October. And I can't tell you how much I've personally missed live music. It is time to get together with friends and family and enjoy again, starting with the summer solstice and Make Music Day on June 21st. The first concerts are coming back to the SAP Center with Guns N' Roses on August 25th. And they say it right there, we're effing back. It's going to be smaller, but the summer San Jose Jazz Summerfest is going to be August 13th through 15th. And yes, music in the park, August 27th, ahead of the Pride Festival weekend. City Dance will return downtown this season in the Circle of Palms, August 6th, September 3rd, October 1st. And boy, are we happy to see San Jose State back in session for the fall semester beginning August 19th. They're expecting we'll average about 60% of the student population going to be back downtown. And on Labor Day, we expect the Serpentine Pavilion to open in the Valley Title parking lot in SOFA, thanks to West Bank and Urban Community. And helping to activate the Serpentine will be the efforts of a new nonprofit, the Urban Vibrancy Institute. And I'd like to recognize our Community Engagement Director, Eric Glader. Today is his last day at the Downtown Association as he takes the helm as the Institute's Executive Director. Congratulations, Eric. Well, the Property Business Improvement District has some great news, and who better to tell you about it than the person who manages the PBID, our operations manager, Chloe Ship.
Good morning, all. Next slide, Scott. I hope that you are ready for some Pocket Park action. If you haven't seen the dog side of our Pocket Park, I really hope you bring your pooch out. My dog Lewis loves it. We're celebrating our grand opening on June 30th. Next slide. Vegilution is putting their final touches on their side of the park. It's a demonstration garden that will be home to farm stand and classes and all sorts of activations. Next slide. Through a partnership with the San Jose Museum of Quilts and Textiles and Local Color, the Vegilution side of the park will have beautiful murals based off of quilt art that the museum has in their collection. Next slide. We've been busy working on this project, but not just this project. Next slide. We have new lights in downtown, many of which are programmable and customizable. Please check out those lights on Post Street. Our landscapers have been hard at work with our spring planting, getting everything ready for people to come back downtown. Next slide. But that doesn't mean we're not working on the future. We're in the middle of our PBID renewal, and we're seeking information and feedback from our members and from downtowners. We'll have a survey that goes out in June for you to give us guidance on what kind of services you'd like to see the PBID bolster, amend, or add in the next 10 years. Next slide. If you have any questions about PBID renewal, you can reach out to myself or Director of Policy and Operations, Nathan Olsch. We're really focusing on innovation and expansion of this district's capabilities. Next slide. Throughout the entire pandemic, our groundworks team has been working hard to make downtown as safe and clean as possible. I hope you've been able to see our groundworks employees of the month on our social media and on our Downtown Dimensions newsletter. Next slide. Our 30 groundwork staff really truly are essential workers. They interact with everyone in the downtown, whether it's helping with a mess or connecting someone with services or just stopping by a business to ask how things are going. Our staff has been here for the last 15 months working hard. Next slide. We hope that you have downloaded our Groundworks Everywhere app or saved our Groundworks dispatch number so that when you're back in the office or back at business, that you can call us if you need to report something that you're seeing in the downtown. Next slide, please. Groundworks is often the first point of contact our unsheltered neighbors make contact with in downtown. We're grateful for the collaboration that we have with PATH, the City of San Jose's Housing Department, and the county's Behavioral Health Department to make sure that we're getting our most vulnerable individuals the help that they need. This last month, our county Board of Supervisors voted to implement assisted outpatient treatment. Assisted outpatient treatment is something that the Downtown Association has advocated for over a decade, and we're looking forward to helping get those that need the assistance, the care that they need through this process and all of the other processes that the county has for those with severe mental and substance abuse issues.
Thank you, Chloe. Thank you, Scott. Really, I'm really excited to see people back coming downtown. I was there this week, and it was great to see people in San Pedro Square grabbing coffee and really coming back, to the offices. And I think we're going to need that. So I'm going to start the program. But before we do that, I'm going to thank some of the people in our city's leadership that are joining us this morning. John Risto, Director of the Department of Transportation, Nancy Klein, Director of Office of Economic Development, Blagues Alales, our downtown manager, and Carlos Acosta, San Jose PD Central Division Captain. And I believe Cindy is already joining us. And we'll have a conversation with her. She represents close to 500,000 residents in District 2, including Central, East, and South San Jose. And please help me welcome Santa Clara County Supervisor Cindy Chavez. Cindy, good morning.
Good morning, Katia, and I'm really excited to be with all of you. Happy Friday. And if it's okay, I thought I would just make a couple of opening comments before we dive into the list of questions that you sent me. One is that I know for so many of you who love downtown that you're also just as mindful as I am about the tragedy that struck VTA. And if it's okay, I just wanted to take a minute, just a moment of silence, just to acknowledge the lives lost for those members of our community. Thank you all. And I want to just say thank you so much for the love and support that VTA has received from so many of you in letters and resources. And we're just really grateful to all of you. Joining me today, in case you, just because I think it's really important and I wanted them to get a chance to meet all of you, is Miguel Marquez. Miguel Marquez is the county's Chief Operating Officer. He is a thought partner and has really taken a leadership issue on dealing and addressing with homelessness. He's both brilliant and also has a very big heart. And Sherry Trejo is also with us. She's the director of the county's Behavioral Health Services Department that includes mental health and our substance use services. Sherry really has hit the ground running since assuming this leadership role. And I really appreciate that she has moved with great urgency on a number of issues. So I wanted to say a very special welcome to her. And then Margaret Obligor, Dr. Margaret Obligor is the director of the Adult and Older Adult System of Care. And she and I have had a chance to work more closely together during COVID. And I'm sure you're going to hear a little bit from her because there's some issues that I want to make sure she addressed. And one that I just want to talk about that a number of you have already participated in. We created an ambassador program during COVID-19 to get the word out kind of countywide about what the needs and issues were of our community. And one of the ambassadors, and actually with the help of David Mineta, really pointed out that we should be getting information out about behavioral health needs and behavioral health services. And so through that, Margaret and Sherry's team have helped us get the word out about services both for people who are homeless, but people who have other kinds of challenges and problems, including both adults and children in our community. And finally, before we dive into the questions, I wanted to say a very special thank you to Chloe and the Downtown Association. You know, this issue that we're discussing, behavioral health and homelessness, really is it's not just a challenge here, it's a challenge across the country. And if it were easy, it would be resolved already. So making sure we have people who are compassionate and smart, ready to work on this issue is incredibly important to us. And I did want to say to the Downtown Association that, you know, I know others have really appreciated the leadership that you've taken to have a compassionate yet sense of urgency around this topic. So I know that our county staff are meeting monthly with Chloe and Pat, and that we're working on getting specific referrals to the help that they need. So Sherry and Chloe, thank you. So with that, Katia, I'm gonna turn it over to you.
Thank you, Supervisor Chavez. So you talk about that, Chloe finished with Laura's Law. So let's start our conversation there. We understand that assisted outpatient treatment will help relatively few individuals. However, those are the ones that are most vulnerable. They're heartbreaking. They're the ones that we see in our streets, causing, you know, some of the disproportionate amount, you know, of the disturbance in the public spaces downtown. So what took so long for the county to opt into assisted outpatient treatment and Laura's Law?
Well, I think the main reason was that, like all of you, when we have experts that give us feedback about what we should and shouldn't do relative to services, we listen to them. We had a lot of folks in the community that were very concerned about the misuse of AOT to restrict the, you know, people in our community who we know need help, but doing it in a way that's compassionate and thoughtful. And let me just back up and say this, that as we began more robust discussions about AOT, concurrent to that, the county was expanding services in a number of areas. And I just want to share a couple of those numbers with you. So we spend as a county a little over $600 million a year in providing mental health and behavioral health services. And we knew, even with the expenditures that we were making at the time, that there were gaps in services, gaps in the way we handle conservatorships, gaps in having emergency mobile response, gaps in making sure that as we were giving people mental health services, we had placements for them, gaps in the number of IMD beds that we had. And so what the staff asked us to do was let them move on all of these other services and demonstrate whether or not we needed AOT. In 2019, in December of that year, after working for a few months with a number of the leaders in the behavioral health movement in our community, we came up with a list of recommendations for the county to be able to address what we saw were still the gaps. And one of them was AOT, and the other was an expansion. And what I hope we're going to talk a lot more about is the engagement necessary to get people to willingly get services, and when we can't get them to willingly get services, how we move them into other kinds of services like AOT or conservatorships. So to the Downtown Association, you know, thank you for your advocacy and keeping that on the front burner. I think the decision the county made was the right one, but I also think that all of the discussions we had with the community were enormously important to making sure that those services are going to be implemented in a respectful, appropriate way. And then let me just add one other thing, because I know this is a really important topic for all of you. There are two key components to AOT that I'm not sure, you're going to ask, I mean, I know we're going to talk a little bit more about this, but I'm not sure we've yet mastered. And one of them is making sure that as we move people through a process, particularly who are high need, that we have appropriate placements for them all along the way. Because, just helping somebody for a short period of time and then letting them go back on the street isn't what we want either. We really need to be able to keep people housed permanently, so that either in a restricted bed or in housing, and then being able to provide those services for them into the long term, because it's not like for most of these folks that we're going to provide services for a few months and they're going to be okay. Maybe for some.
And you talk about gaps, so let's stay there for a little bit, because now that the county will be implementing AOT, what are those additional things that the county needs to add or implement to better treat those chronically homeless individuals with that severe mental illness? And how do you see these 2 or 3 things, will complement or bolster the implementation of AOT? And would they help with those gaps that you talk about?
Well, there are really 2 kinds of gaps that I'm speaking of. One is, let me just go back and say that we have increased the amount of resources we're spending to address behavioral health issues by 33% in the last 3 years. That's how we got to the $600 million. In the coming weeks, you're going to see in our budget process, actually starting this next week, you're going to see an even greater investment in some of the components of that we're going to need to have available. And let me just give you one really important example. Many people don't know that in Santa Clara County, we already have about 150 to 160 locked beds, locked facilities where people are forced to stay because of their mental health issues. We've had 2 challenges with that. One is that we need to be more disciplined about checking in to see if people still need that high level of care, and then making sure we have enough placements for them so they can step down into other care, so that people who really need that high need care can move into those beds. Part of what we needed to make sure of is that we had the services, the step down services that are still very intensive, so that someone could live in the community, that include wraparound services. So one area that I see is that we need to continue to fill out the other slots and make sure we have not just the services, but a place for someone to stay, because having them be severely mentally ill and getting services and living on the street, as we know, is very difficult for people to have success. But the other, and you'll see this in our budget next week, is that we're going to expand the number of those beds that are essentially locked or hard to leave, to increase it from where we are now to add another 35 beds. I was actually hoping for 40, but 35 is what we got in the budget. I think that's going to be enormously helpful. And then the other is that, just as a reminder, the state doesn't take patients anymore. So the state used to take patients at a state level to help people become more competent for standing trial, for example. But those beds have almost no availability, which is really pushing back not just on our county, but counties across the state to try to make sure we have placements and treatment in areas that the state once would have been the primary treatment provider. There was one other area that I wanted to make sure I touched on in that. Apologize, Kathy, I'm looking through my notes to make sure.
No problem, we may go back to that, but I just realized that maybe if you can give us the elevator speech of what assisted outpatient treatment AOT is. I may have jumped a little too fast and, and what the rest of the audience may know about AOT. So do you mind giving us, the 1 minute of what AOT is?
Absolutely. What this is that this is a process by which a mental health provider, a family member, or a police officer can really essentially use the courts in order to essentially force somebody to get treatment. And in most places in the state, what we found is that going to court means that you can bind somebody essentially in a court settlement to have to get a certain level of treatment. For what I think and what I've seen in different parts of the state is it's primarily been used by family members who have a family member that is dangerous to themselves or to others, and there's a lot of risk of that person because of not getting help, damaging their own life or their family members' lives or other people's lives. In most processes, and this is one of the, I'm glad you asked this question, Katia, because one of the areas that we need to really beef up our services is in engagement, because in most situations, the court process really creates an opportunity for the family, the person who is in crisis, and other supporters to get that person the treatment they need actually without the court action, because it's really got this engagement component to it and this discussion component to it. But for those who refuse to get help, the courts can force them to get help. They can't force them to take medication, but they can force them into a treatment plan.
Thank you for that clarification. Let's talk about what additional health service innovations you would like to see implemented that you can share with our members. Where do you think that are additional county, behavioral health service innovations that you will look for?
Well, I think that, one thing that we're really trying to hone in on now, and I'll come back to the innovation point, but I just want to spend a minute more on the need part, Katia, is that, Santa Clara County is unique in that we spend more money than most counties on behavioral health. Most counties spend only what they can get a state match for, a federal match for, but we're one of the few counties that overspend in that area. And the reason I'm sharing that with all of you at the Downtown Association is I want you very much to understand that this is a priority for the county, and that it's been a priority for the county really since Jim Bell was on the board, because Jim was so interested in behavioral health and mental health services. As it relates to innovation, one of the grants the county just received through the state in partnership with our nonprofit partners is a community response to people who are in mental health crisis. And this is a program that will be partnering not just with the city of San Jose, but cities all across the county to be able to have a response that's not a police response when somebody is in mental health crisis. One of the concerns that I have about this is it's going to have its own direct, people will be able to call a community number and not go through 911. And I'm a little bit worried about that, because I think it's very difficult for people who are lay people always to know what the appropriate response would be. And so we're going to have to test that and really rely on our nonprofit partner professionals to help us understand whether or not we're responding at an appropriate level with the appropriate kind of response. And we're going to have to be very diligent about learning from that experience. The second thing I want to talk about is something that we've already done in partnership with the city of San Jose. Many years ago, when I first got on the board, we established and expanded what is our sobering center. And it is in at the old City Hall site, right across from the San Jose Police Department. And it's a service by which a police officer who finds somebody who's in crisis, or really intoxicated or on meth, as long as they're not violent, they can bring them to the sobering center. It takes about 5 or 10 minutes. If you book someone, it could take an hour, but they're able to drop that person off, and that person can sober up in that environment. They get snacks, there are counselors there. And if they're interested in getting services, if they want to go into a drug or alcohol rehab, they can do it right then. And that they will get a ride from there. They don't wait in line. They can go get services. One of the things that I realized is that we had designed that in partnership with the city of San Jose. We had a difficult time right away getting the San Jose to use it for a bunch of reasons that have more to do with miscommunication, but we fixed all that. But right now what we're doing is we're giving all the shifts tours of that facility so they know how it works and how to use it, because it's underutilized today. And so that's an example of something I think that we need to test further, see how many people we can get in, see how many people that come in actually say yes to treatment, see how many times we have to talk to them before they say yes to treatment, and then get them connected to treatment. And one other thing I'll just add, for any of us who have family members who have mental health issues, it is very challenging, or drug and alcohol issues. It is extremely challenging to get people help until they're ready for the help. And so one of the things we're really trying to learn is how do we expand, in partnership with our nonprofits, the engagement process that really does get people in a place where they can both accept help and then really benefit from it.
You touch a nerve. My mother struggles with mental illness, and I remember that moment when I didn't even know who to call, what to do, who to reach out. And you're dealing with a family member, somebody that you love, and at the same time you also need that help. So thank you for pointing out that, yes, also the families and and the people surrounding the people with mental illness needed that help in order to get our loved ones to be in a better place. So let's talk a little bit about protocols and maybe a little bit of some of those services. What is in place at the county to ensure that there's no wrong door, that you can access behavioral health services? We were talking about not just the individual, but the family. What is already in place?
Well, I'm going to actually ask Margaret and or Sherry if they want to weigh in on this, but let me just make one point. I don't think we're at the no wrong door yet. And that's really where we have to be able to get services, is with zero barriers. Like for me, it would be one phone number you call, zero barriers, multilingual, one assessment, and then you can get people to the place that they need. We're not there yet. I do think that we have an opportunity to get there. I think Sherry and her team are really working on that. And I will also say that, we have an adult system of care in our community. We also have a child system of care. And so both of those systems are I think can be very challenging to navigate. And we're really trying to do a better job of listening to consumers, listening to families, and listening to parents, and making it much easier for us to making it easier for people to access services. But Margaret, do you mind if I turn that over to you and just get your perspective on that?
Thank you so much.
Thank you, Margaret.
Thank you, everyone, I thank you for inviting me here today. And as Supervisor Chavez has mentioned, we are working very diligently on trying to really create a no wrong door approach. And so what we're looking at is the various systems where individuals are coming into the system and really trying to use an opportunity to create a more seamless system for those folks. So for instance, individuals who are coming out of our inpatient area, coming out of EPS or emergency psych services, we're really building a lot more of a liaison where we have a social worker assigned, and the social worker will be responsible for really transitioning folks and assigning them to intensive outpatient services, or also to referring them to our urgent care if that's what the individual needs. So we're looking at the various levels of care where individuals are coming into the system and using that as an opportunity to really create a no wrong door approach. In the outpatient world, I know there's been an over-reliance on our behavioral health call center, but we also are instituting a same-day access to care, whereby if an individual does call the call center and want to be seen that day, that we have clinicians lined up for that person to be seen and assessed and provided the services. The other piece we're also working on is towards the criminal justice world, as individuals are discharging or being released from the jails, that we do have the reentry center as a place where individuals can access services immediately, and that they could be referred to all of the other services that we have available. So we have aftercares in the jail prior to release. We have individuals who are coming out of other parts of the county that are seeking services, that we can also create hubs whereby the individuals can be able to access services immediately. So at our various ports of entry through our crisis, mobile crisis services, if it's out in the community, they have a direct referral to our in-home outreach teams and our homeless outreach teams as well. So just creating a lot of opportunities that are more seamless and that does not warrant the individual calling the call center all the time is really the approach we're going. So similar to what Supervisor Chavez said, we hope to get a one access line that would be able to funnel individuals to all various services if that's the need.
You know, and one thing, thank you, Dr. Obalor. One thing that I would also add is that, you know, we, like I said, we did these 101 trainings for community members around adult health and children's mental health. And we can make those videos available to all of your members. So if there are folks who really want to understand the system as it is today, not where we're going to take it, but just to be able to walk people through and make sure that folks that you all know can have access to services, we can make that available. And the other is that if the Downtown Association, if you have a subcommittee of folks who are interested, we can do a 101 for that group. And it's also a great way for us to get feedback, real-time feedback about how we improve the services. So, you know, that I think, you know, for people who are really, really interested, we're interested in diving in with them on that. And thank you, Margaret. You guys are doing amazing work stuff.
We will take you upon that offer of, you know, doing one-on-one and, you know, getting more involved. The next question, maybe it's a two-part. Our homeless, our unhoused, there's not one size fits all. Some of them are suffering from mental illness, some of them from addiction or substance abuse, some of them are neither mental ill and just, you know, choose to have a homeless life. So how does the county address these different homeless situations? And also, how is the county going to work with the city to provide those resources for those that are mentally ill that are in our streets? Because those do not have access to a phone. They may not have the support system of their loved ones around, you know, that can help them in those moments of crisis. So do you mind talking about how, again, the county will work with the city, providing those resources to the mentally ill on the streets, and how do you address the different populations of homeless that we see?
Yeah, I think that, you know, one thing to remember is that I think it's really important for us to understand that without housing people, providing support to them is very difficult. And I just want you to, and I don't know how many of you have ever suffered with an addiction or mental health needs yourself, but imagine dealing with that and being homeless. And so really what we're working as hard as we can to do is make sure that we're building out the housing that we need as quickly as we can and getting people access to housing as quickly as we can. And I think it's also really important to understand that I know we have a lot more work that we need to do in this area. Like that we're not even close to done. What the nonprofit community is sharing with us is that they think we need to really do more, really along the lines of what Groundworks is doing, which is meeting those people where they are and trying to connect them to services. And then really the reality is that we need to have a zero line for access to services. Like people can't wait if they're ready to get off of alcohol and drugs, they can't wait. We need to be able to house them and get them the services they need, or get them the services they need that are inpatient and then house them. So I think what, you know, that's really a very big challenge. I don't want to lie to folks, like we're not there and we need to get there. It's really, really critical that we do. I want to add one other thing that we haven't talked about today, and that is that it's really, in my mind, important that we do as much as we can as early in life as we can for folks so that we can deal with mental health issues so before someone becomes homeless, that there's not such a stigma that people can't get the help they need. So one of the things that the county is doing right now is building out a psychiatric facility, medical facility for young people that and adults, but that will really focus on making sure that young people, even if they have both a medical and mental health issue, will be able to get services early. Because right now, if you have a child in crisis, you are going to Fremont or you're going to San Francisco to get services. This is going to be a state-of-the-art facility. It's a $400 million investment that we are building out right now that will be for both adults and youth. But the idea is we've really got to take the stigma away from mental health so people get the help they need earlier before they're adults and in crisis. We're also opening a facility called Alcove in partnership with Stanford on Keys and 2nd Street in the next couple of weeks that is really geared toward young people. It's going to be both a medical facility and a mental health facility, but the idea is taking the stigma away so young people know where they can go to go get help. It's actually in part governed by young people, the services and the approach. And so we think that by taking the stigma away, we're going to be able to deal with prevention, because what we don't want is to deal with thousands of people that we're dealing with now that have these really serious needs, if in fact we could be preventative for any of them, because long term, I don't think we can continue to try to just build our way out of this. We've really got to be more focused on prevention.
Final question, and you talk about this when we were talking about services, but you also talk about the need for place, the need for housing. So let's talk about Measure A. Measure A from 2016, and it was close to $1 billion in funding for affordable housing. How do you see that we have implemented Measure A? There's still a lot of units that we would like to see built, and they are not there yet. Can you expand a little bit on, what can we see on Measure A?
Well, let me just start by saying that the county invested in housing because when cities no longer had access to redevelopment, what was clear to me as a new board member is that housing is going to be everybody's responsibility. It's not just the city's responsibility. And frankly, it's not just the county's either. This is, it is a crisis that belongs to all of us, and all of us need to step up and do our part. What was most important to me about Measure A is that it's one of the few funding sources for extremely low income housing, the housing that people who are homeless need to be able to access. Of all the housing, of all the affordable housing that's been built in California, I think in the last 5 years, only 12% of it, 12% of new housing has been for extremely low income folks. And that's just not enough, which is why as a community, we invested in Measure A. Measure A's goal is to build 4,800 units of housing. And the 4,800 units of housing within 10 years, even though it's a 30-year bond. And, everybody told us that would be too fast. And we've got almost all the money committed. What I would say that the biggest challenges have been siting that housing, making sure that it can be placed in communities across the county. And then the second has been that we've had a very difficult time getting the funding we need from the state to make sure those projects can pencil and that they can move forward. So what I'm hoping is that working with the city of San Jose and cities across our state, that we can get the state to restructure the way they make tax credits available so we can get access to that and build faster. We're building now. We have people already living in Measure A homes, and I'm excited about that. But I always want everything to happen faster and better, and we'll keep putting pressure to get in that direction. And then the other thing I wanted to say too is that one thing that in our community that we just can't really ignore is that while we have a huge problem, I do just want to thank the folks that are really trying to address it. I mean, in our community, we really have housed thousands of people and kept thousands and thousands of people from becoming homeless through our rapid rehousing program. And of the people that we've been able to house through Destination Homes leadership, you know, over 3 years slides, when we go back to look at how many people are still housed, and these are very hard to serve people, we're keeping 93% of people in their housing over the time that they're there. And these are really important accomplishments that we need to build off of. I think one of the challenges is it's hard to see the successes, because the successes are housed and getting mental health services every day from the county or our nonprofits or the private sector. And these are folks that are able to stay in their housing. I think the challenge is that we still have a long way to go. And I'm really looking forward to work with the Downtown Association to be able to continue to house people and treat people in the most humane way we can and help people have the healthiest lives we can. So Katia, thank you for letting me join you.
Thank you, Supervisor Chavez. Anything else that you would want our members to know or remember or be aware of?
Yeah, I mean, I would just say I'm really looking forward to an opportunity to do that Housing 101. I think it's really critical. And I just wanted to give a couple numbers that I think might be important for your members to know. One, that since the pandemic, we got a question that someone sent me asking how many people we permanently housed during this time. And permanently, we'd housed 500, I'm sorry, almost 2,000 people, 1,500 of them through our rapid rehousing program, and through our permanent supportive housing program, 529. And then another 7,500 in interim housing. And my point only is that the challenge is huge. Like, we have a lot of work to do, but we're actually getting quite a lot done. And we need to work together to make this happen for our community. And I'm really excited about that opportunity. Thank you.
Thank you, Supervisor Chavez. And next we have Councilmember Raul Peralez, a lifelong resident of San Jose and representing Council District number 3, including our downtown core and surrounding neighborhoods. So Raul, Councilmember Peralez, are you here?
Yes, I'm here with you. Can you hear me?
Yes, I can hear you. How are you doing this morning?
Doing well, thank you.
Let's start with some of the questions. And this question came from one of our members, Frank. We're wondering that the temporary shelter at South Hall now has officially a closure date in mid-July, and there are approximately 200 residents there. What is the city's plan to ensure that these individuals are connected with transitional or permanent housing? And what happens if there's no housing available for them?
Yeah, thank you. And I will jump right into this question, but I just wanted to say that I'm happy that our director, Jackie Morales-Ferran, is here. I think she's made some comments in the chat as well. And our deputy director, Reagan Henninger, is also here. And just as it was teeing off of the last question on Measure A, I literally just got back into my chair from running out to 2nd Street Studios, which is the very first 100% permanent supportive housing project in the county. It's in my district as well. And it was their very first dumpster day. And they did it in partnership with the nearby neighborhood association, Spartan Keys. And it's just, I think it's, we know we need a lot more, but at the same time, I think we have to look at some of the successes and things that we can build on. And so it was exciting and it was important for me to be there with them today because it was their very first self-organized dumpster day, and just I think a community that just a few years ago was out on the street, and then now they're helping to organize and better and beautify their neighborhood, and that's what we're hoping to get, and as well with these individuals that we know we have in the South Hall tent. Going back to your question, we do have an official closure date, which is July 15th, and there are approximately 200 people there, as you point out. Actually, we have approximately 250 that are there. And we are working right now, our staff are working in partnership with Home First on meeting with every single participant that is there to try and help them develop personalized housing plans, trying to see if we can't identify housing needs through our vulnerability assessment and their individual needs. And the goal is to try and get every single one of those individuals assigned to housing or interim bridge housing, a motel voucher, you name it, to be able to try to get them into shelter or housing rather than simply displacing them back out into the streets. And no doubt it's not going to be easy, but we have sheltered over 6,000 people during this pandemic and housed nearly 3,000 actually. And so we're optimistic, but I have asked that our housing staff keep track of every individual and that we do get a report back so that we can see how successful were we on trying to relocate these approximately 250 people.
Thank you, Councilmember. I'm gonna switch a little bit, but still related to housing. You have champion sanctioned encampments. There are some cities that have failed in their attempts, with sanctioned encampments. So is there really a path in San Jose for sanctioned encampments, and why? Why not looking for other solution, or is this the right solution? Or one
Yeah,
of the
absolutely.
solutions?
First I will say absolutely. I do think there is a model, a successful model, and if any place can innovate and learn from others' failures, I believe it's us here in Silicon Valley, and that yes, we can find a way to successfully create a sanctioned encampment model. I think that what it is it's simply one tool in the toolbox, though. And as we know, right, we at the moment are in a moment of crisis. And that's why I feel it's important that we are really utilizing every single tool that may be available. And even if we were to pilot something like this to see how successful we could be, and then be able to expand that, that is my hope and goal. That's been my hope and goal. But unfortunately, as you point out, it has not been successful in other locations, and it has not been successful in getting support in even attempting a pilot here in the city of San Jose. For me, I think the most important thing is just after this pandemic, for me, I look at it as an opportunity, a moment of opportunity as well, where I don't want to go back to where we were pre-pandemic, which is simply to abate these unsanctioned encampments and usher people all around the city, or likely, as we tend to see, just a few hundred feet or a couple blocks away, and a lot of times within 24, 48 hours, actually re-encamping the very same location. And then we're essentially just back in that cycle. So that was the hope to be able to do that. But unfortunately, at the moment, we're not going to be able to pursue that.
Do you think the city has the bandwidth to implement the program?
They don't have the bandwidth right now. That was actually part of the conversation, was we would need to add on 1.5 full-time equivalent employees within our housing department to be able to do it. And that was to the tune of over $300,000. And so we would have to invest. We'd have to invest in the personnel to create the bandwidth in order to create this program. So we don't have it today, but that's what we had an opportunity to do. And I asked for that funding through our one-time essential services reserve to be included in our budget. The mayor did not include it in the budget. And then my colleagues, when we debated this item a couple of weeks ago, also voted not to include this as something that we'd like our housing department to pursue.
You talk about COVID. So I'm going to ask you a question related to that. The city put a number of initiatives in place under emergency measures during COVID. What do you see that is going to stay? Which provisions do you think will be lifted? For example, the project room key, or their temporary housing hotel rooms, but they are no longer subsidized under emergency provisions, and they may need to check out. So what do you think is going to stay, and what is going to take maybe a different spin of what was implemented before?
Yeah, it's a good question. And in fact, a lot of the provisions that have been lifted are at a state level, things that have helped us to expedite our bridge housing or our tiny home projects. And things like Project Room Key, as you point out, that actually the state created the successor model to that Project Home Key, essentially saying, could we transition some of these rooms that we have offered up to people now, and actually can we purchase the entire hotel and then create those into short-term or even longer-term stay single occupancy units. And that actually we've seen success, some of the first in the county and actually in the state, and being able to purchase a hotel for that purpose. And so I do think we will see a lot of the successes from during this pandemic be able to stay. It may not be the exact same in the exact same way. Like for instance, the Project Room Key, I think in essence will go away as you start to get some of these hotels and motels that are going to be creating occupancy once again, and then obviously the transition to that, things like Project Home Key. But I think some of the most important things for the city are going to be streamlining, are going to be the opportunities that we have had to move some of these projects a little bit more quickly. It's my hope that we have some of those in place, and that's still to be determined. I think some of these questions are still up in the air on what it is that we may see be more permanent, and that's the case for, I think, all industries right now that are waiting as decisions are being made up and down the state.
Somebody commented on the chat that COVID has also put stress on low-income communities. So how are we addressing those people that may be not homeless yet, that they may not be using projects like Project Room Key, but are at that vulnerable stage of maybe getting to that point? So how can we address that population that may fly under the radar and they actually need the help? What are your thoughts?
Yeah, I would say actually a lot of these individuals are not flying under the radar. We actually know who they are, and we're offering assistance to them today through rental assistance programs. And this again is also up and down the state, and with state support, we've partnered with the state to do a hybrid model where we can provide some local and state support here to residents that are struggling to pay their rent. They're sort of on the verge of homelessness. And we know that this is a big component of the challenge and has to be a focus of the solution, because what we're seeing today is for every one individual that we can actually remove from homelessness and get them into some sort of shelter or permanent residency, we have 3 people that are entering homelessness. And so it's those individuals that you're talking about that are right there on the verge and struggling. If we can help them through what may be a difficult time, who knows what it is right now, COVID, maybe they've lost their job and they're now struggling and they're on the verge of homelessness. And if we can provide them support to bridge that gap, these are individuals that clearly are proving that they're housed today. So let's keep them housed, right? It's much easier to keep somebody housed than to try to get them off the street. And so we are doing that. There is a focus, again, up and down the state and locally as well, where we have a rental assistance program where we are trying to help people that are in need of that assistance on the verge of homelessness and identify those individuals. There are, indeed those that may not be aware. And so we want to try to continue to promote that so that way they are seeking help that we may have available for them, because it's definitely easier, again, to keep them housed rather than try to help them after they're homeless.
Very similar to what Supervisor Chavez was talking about, prevention with mental illness rather than just waiting until those people need those services. I'm going to switch a little bit and talk about D3 and downtown. And D3 has accepted, and supported many temporary pilot programs and permanent homeless housing solutions. The city is looking at a new dispersion policy, and even Supervisor Chavez, during our conversation this morning, talked about the challenges of siting affordable housing and homeless housing. What are your thoughts? Are you optimistic that this potential new policy will help equitably distribute housing across the city, maybe even outside of the city, to other cities? What are your thoughts about siting affordable homeless housing?
Yeah, this issue has become very important to me and my community here in District 3. And I've been able to learn about its history over the years and seen, obviously, the disproportionate number of units that are going into particular districts of the city, like my district or District 7. And I've seen over the years as well a number of projects that are proposed throughout the city. And obviously we see this as well throughout the county, but specifically in San Jose throughout the city, they get a lot of opposition and ultimately don't proceed. And through that time, I looked into and learned about our affordable housing siting policy, is what we're calling it today, but it was called our dispersion policy previously. And the idea was to disperse affordable housing throughout the city, and in an attempt, right, to not concentrate that in particular areas of the city. And there's a lot of benefits to that. I won't jump into it, but it wasn't working, essentially. It didn't have any teeth. It was more of a guideline, if anything, and we did not see it help us to actually equitably disperse affordable housing. And so a few years ago, I proposed that we look at that policy and we update it and we give it some teeth. And additionally, we also look at how do we not only equitably disperse affordable housing, but how do we provide support in those communities where we are seeing a lot of affordable housing, and specifically some of the housing like permanent supportive housing, individuals where or units where we know are housing people that need a lot more support. And how do we ensure it's not just support within the building, but that we're providing those amenities in the neighborhoods, things like parks. It's one of the issues where, as I just stated this morning, I was at 2nd Street Studios, and one of the things that they started clamoring to me about as soon as they moved in was a dog park, because a lot of them have dogs, and they, hey, where's a nearby dog park? And there isn't one nearby. And so, you know, it's those things. It's going beyond just the building and the services we may provide to individuals to what is it that we're providing in these communities where we are citing affordable housing. And so I am proud to say that after a couple of years of work, this policy is coming forward within just a couple of weeks to the council. Our housing staff has been working diligently on it, on what, again, we're calling now a siting policy, affordable housing siting policy. And it's exactly going to look at that. It's going to look at what areas, and we're looking at areas of opportunity in the city, of high opportunity versus low opportunity. And these are all sorts of statistics that we're looking at, things like high crime, education rates, right? And looking at what that really is defined as high opportunity locations versus low, and ensuring that we are placing these affordable housings into areas that have high opportunity. And when we're placing them into an area of low opportunity, that we're going to provide more of those opportunities, and we're going to focus that. So it's just being more conscious about where we're citing. And inevitably, I think this, because it will have more teeth, the teeth here will be the city can opt out or refuse to actually contribute to a project and say, sorry, we're not going to help fund this project. And as you know, in order to build a lot of these affordable housing projects, they depend on funds like the Measure A fund or city dollars that we put out in funding availabilities. And if they don't have those dollars, a lot of times they can't build a project. And so that's the teeth that we will have now, is to say, hey, you know, I'm sorry, unless we can see it in a different area, or unless we can get these improvements in a particular community with it, then we won't fund that. And so I'm excited about this policy coming forward, and I do think it will actually make a difference here.
I think you're right. I mean, it's not just one building. As an architect, you know, it's not just one building, it's whatever is around it and support and what's happening around, and that's what forms communities. Buildings do not make communities on their own. So that it's going to be interesting to see, you know, how the efforts are being done in order to cite those affordable housing projects. Do you think that there's an ability for the Office of Zulma Maciel and Racial Equity to work on these citing opportunities? How do you see her efforts working, particularly with this equitable distribution also of housing solutions?
Yeah, I absolutely do think there is an opportunity, but what I will say is that our housing team also was wearing that hat of looking at this equitably, looking at the impacts of race and income and those disparities throughout the city. They were doing that already because they've been working on this for a couple of years, and our Office of Race and Equity really didn't get up and running until the end of last year. And so our housing department was diligent on focusing on those needs through their analysis. But as we move forward, because this policy doesn't exist yet, right? Hopefully, that's what I'm hoping for, is that the council will adopt it and that we'll put it into practice. And in that place, I absolutely think that our Office of Race and Equity can help us to guide that along, because no doubt it will likely see some changes over the years, and we're going to determine, is it working well, or what is it that we need to analyze or look at differently. And during that time, I think a partnership with our Office of Race and Equity and our housing department is going to be key.
We have an amazing housing department. So yes, I know that they were doing that already. So this in my mind is a natural next step on what they do. Let's talk about homeless concerns. And we still see tents, and we continue to see more tents. There's accumulation of possessions in public parks, sidewalks, how do we balance that empathy and compassion for our unhoused population with some of the real associated negative impacts in our shared public spaces? It's sometimes it's tough as a single woman, walking on the street to walk in certain areas. So how do you see as the right balance?
Yeah, and this is a real legitimate concern for any individual that is living or working around areas where there are encampments, or as you point out, where areas where right out in maybe the public right of way or on your pathway to work, there's tents, and then there's trash being accumulated. People that are unhoused, that are accumulating all sorts of things as well, and additionally, right, just the challenges that they're facing a lot of times with mental illness and things that are making people feel uncomfortable as they're around there. But as you also point out, there's an interest from most of our community to be very compassionate and empathetic to the needs of individuals that are homeless, and there's this, I think, constant conflict of wanting to be compassionate and empathetic and help somebody, but then also wanting to feel safe, wanting your city or your pathway, to work or home to be safe and to look clean, wanting our creeks and waterways, right, to not be littered. All of that and the above is there's obviously an interest to do both, and I think that's fine. I think that's fine that that it's challenging to be empathetic and compassionate, and that people are at times frustrated with the realities of what we see. That, I think, honestly, is what helps drive change. I know that that's what drives the interest of individuals, right? To email my office or to call me and to say, well, some say, just do something about it, Raul. and others say, how can I help? And for those that say, just do something, a lot of times what we do is we invite them to help. We say, look, this is a full community effort. Supervisor Chavez was mentioning that in her comments as well, is this isn't just something that the county and their staff need to work on, or that the city and then our staff, or that somehow there's one entity or responsible agency that needs to work on this. This truly is a pandemic in and of itself, as we know, and it's going to need the entire community, because as you pointed out earlier with citing, the last question, one of the major challenges we have with citing is getting community support when we go to cite one of these permanent supportive housing development, and the tremendous amount of opposition that we get from our community. And a lot of these community members may be people that are demanding us to fix the problem or change things, but yet not necessarily willing to accept some of the solutions. And so I think that's, for me, where we try to direct the energies, whether they're anger or frustration, or if it's compassion and empathy, to direct it to help us with the solutions. And number one is really, and I think SJDA is a prime example of this, and under the leadership of Scott, because over the years there was a transition as well with the Downtown Association on how do you deal with homelessness in the downtown core, and moving from how do we just manage it and maybe clean up certain areas to how do we be a part of the solution. And was the second 100% permanent supportive housing development in the county was built and is running right in downtown, right next to St. James Park. And that was through partnership and support from the local community, the business community, the residents around it. It wasn't easy, but we were able to build that, take from that energy, take that compassion and empathy, and help turn it into a solution. That's where I think, we want to continue to direct people. And I think that's where people feel most fulfilled. They recognize, that these are daunting challenges, but when they can see some success, right? When you see success in a particular area or a location, again, like Second Street Studios, where I was today, the neighborhood association of living in single family homes, right? They were out with the residents of Second Street Studios today to help them with their dumpster day. It's that little bit of success that we need to multiply, right, tenfold, to really be able to make a difference.
We didn't send you this question, but I hope you don't mind. You talk about measuring success. How are you measuring that success? How's your office measuring that success?
Well, I think the number one way to measure it is, are we decreasing the amount of people that are experiencing homelessness, right? That overall big number. Are we going in the right direction, or are we not? And unfortunately, over the last number of years, we know we're not, right? And actually, to the tune of thousands of more individuals from where we were when I started office that are identified as homeless today. And so I think that, you can measure all sorts of other, successes that we've had, like we've talked about during the pandemic, which is how many people have we housed or how many people were we able to shelter. But at the end of the day, I think the reason why so many of us look around and say, well, I'm not seeing, those numbers look big and they look good, but I'm not seeing the difference. Well, it's because the overall number, and this goes back to that challenge I was pointing out where we can house somebody, but then 3 people enter homelessness. So if the overall number is growing or staying stagnant, then we all have to expect to still kind of see the same thing. Even if we know we've housed thousands of people in this past year, you look around and you go, I don't see thousands less. I'm seeing what looks like the same challenges I saw last year. And the reality is yes, that's true. We didn't do our homeless census count earlier this year because of the pandemic as we normally would have done. But I think we're likely to see that those numbers have not really diminished very far. And that's really that's the measure. That's the sole measure. Are we decreasing overall homelessness in our city and in our county? And if we are, that is going to lead us to seeing all the other changes. You're going to start to actually see encampments diminish if the overall number of homelessness is going down. You're going to start to see these impacts on our community go down. You're going to start to see less of these individuals that are challenged living on our streets on a daily basis, right? Because overall, we know we are really diminishing that overall number and getting to what we want to do, which is ending homelessness. And so we're not moving in the right direction as of the last several years. We know we need a lot more solutions. That's really what it is, right? We need a lot more permanent and temporary transitional housing solutions if we're going to truly change this number. And we need to resolve, and I know Jackie was pointing this out in her comments, we also need to resolve the fact that just how unaffordable it is in this valley, because these are the people you were talking about that are on the verge of homelessness, but they're not homeless today. Maybe they've never been homeless in their life. They're working poor. And because of the high cost of housing and the high cost of rents in the area, we're now driving them into homelessness. That's again, that 1-to-3 ratio. So we can't forget that either. We have to focus on that. It's not just a homeless problem. It's an affordable housing problem. It's a problem that we need to address from really its start, from what is leading somebody into homelessness. And that's what makes it so daunting, right? As we know, because there's not one easy solution.
It's daunting and it's a complex issue. I mean, we talk about mental illness, but it's related to homelessness, but it's not quite related. There's some people that have mental illness that still need the services. They need place, and how those housing, helps with all this. So it's still something that I think we need to continue talking. So last question. Where do you see the San Jose Downtown Association and the downtown community helping to solve, even if it's just a little bit, of these issues that we have talked this morning?
Yeah, well, first off, I think is education. It's actually what you're doing today, because a lot of individuals are just unaware of the realities. They're unaware of how challenging, right, some of these solutions are. Unaware of the causes of homelessness, and we can't do just one education session, right, or leave that up to the county or the city or Destination Home or other organizations. I think we have to continually do that, continually educate our community, keep them informed of this challenge, and going back to what I said I do, is invite people to be a part of the solution. And I'll actually be doing that later this afternoon. Sorry, my dog's going crazy. I'll be doing that later this afternoon with some business owners along Coleman Avenue that have been dealing with during the pandemic, the 300 plus individuals that are living in the Guadalupe River Parkway. A lot of very frustrated business owners that are there, that along Coleman Avenue, that we're going to get out and try to see if we can't channel that energy again, right, to be able to see how do we help in these solutions. And so number one, education. Number two, it would be to support us in the solutions. As I was saying earlier, that's one of the biggest hurdles that we run into when it comes to siting, is not getting support. The mayor and I and our housing team have been working towards another tiny home or bridge housing community right along Taylor and San Pedro that is going to be near the police department, in actually in a city-owned parking lot of over 100 up to maybe 200 residents, where we can put in there. Well, we're going to need support from the surrounding community to be able to do that. And those are things that we can ask individuals that say, hey, if you want to help us be a part of this solution, help us support the solutions that we bring forward that we know will actually achieve some success. And then lastly, I would say, whether you work downtown, live downtown, or wherever you live, take that back home. Take the education, take the messaging, and take it to your own neighborhood, because you're likely going to find a lot more opposition, right, from individuals, maybe of your neighbors that aren't well aware of it, or people that don't work downtown, or just for whatever reason, right, they're not as informed as you are, and they may have that initial reaction of being opposed to some of these solutions when they come to their community. And help educate your neighbors that we all need to be a part of the solution, that those within our unhoused community or on the verge of homelessness are community members just like you and I, right, and that they need our support as an entire community.
Councilmember Peralez, thank you again for talking to me this morning, for answering some of our questions, answering some of the questions from the chat. And a reminder for everybody, that downtown, it's open. Farmers market is there today. So hope to see you soon. Thank you again.